Good day, everybody. This is Chris with the Ancient Scholar. I hope this video finds you all doing well. So this is going to be the Ancient Scholar After Hours edition. So one of the things that we have to do at work is we have to have a full-time faculty member cover the division after official business hours have ended at the college for a certain amount of time, because we do have night classes and people may come and go, and we just need to ensure that there's some coverage. And so what we have is a schedule. We have a rotating schedule where each of us takes turns covering the offices after hours, and it just happens to be my turn today. So here I am. And what I thought I might do while I'm hanging out here for the next couple of hours is just do a quick video for you all. And the video that I'm going to talk about, or what I'm going to be talking about today, is just a quick little paradigm that you can use to help conceptualize or help think about the differential diagnoses for life threats or acute life threats in the setting of a patient that is experiencing or complaining of acute abdominal pain. And they fall under the umbrella of VIPO plus or minus E. That's VIPO plus or minus E. So what does this stand for? Well, V stands for vascular differential diagnoses. So these are acute life-threatening vascular conditions. So you want to think about things like blood clots, right? A clot in the mesenteric circulation that causes mesenteric ischemia, for example. A AAA, abdominal aortic aneurysm, that is compromised, is ruptured, is acutely bleeding. Okay, something on the lines of that. You also want to think about the possibility of a myocardial infarction. That's not technically the abdominal cavity, but we know that chest pain can radiate or can present with abdominal complaints, nausea, vomiting, and yes, even abdominal pain. So you should always have cardiovascular problems as part of your differentials in your patients with abdominal pain. So your threshold for doing a 12-lead ECG should be incredibly low, and I dare say that virtually at least every adult patient with complaints of abdominal pain should at a minimum have an ECG performed on them. Okay, so those are some of the vascular problems that can cause acute life threats. Let's talk about the I. The I of the VIPO is itis, I-T-I-S. So that is an inflammation or an infection. All right, so inflammation or an infection of critical organs, right? So what are some examples? Hepatitis is a big one, right? Is there some acute inflammatory or infectious process involving the liver? That's hepatitis. Pancreatitis is another big one, right? Do you have an acute infective or inflammatory process involving the pancreas, right? What about cholangitis and cholecystitis? So acute infective or inflammatory processes that involve the biliary tract. Now, not all of these are going to be acutely life-threatening, but they certainly can be. Cholangitis, for example, can be quite a bit more concerning than maybe just some biliary colic, right? Colitis, right? You can have life-threatening colitis as well. So those itises, peritonitis or appendicitis, okay? So those are some of your life-threatening itises or infective and or inflammatory processes. P is perforation, right? Is there a perforation? Perforations generally are going to be life-threatening when it involves the abdominal compartment, the abdominal cavity, right? Perforations tend to involve hollow organs such as the stomach, right? Such as the large bowel and the small bowel. We call a bowel perforation, because then that leads to peritonitis, which is a life-threatening intra-abdominal infection. All right, so perforation. Obstruction, that is the O. So vascular, itis, perforation, obstruction. So acute obstructive pathologies such as a substantial small bowel obstruction, right? That can be due to an ileus, that can be due to a tumor, some sort of mechanical issue, right? In addition to that, you can have obstruction of the biliary tract or the pancreatic duct. or anywhere in that whole network, even as high up as the common hepatic, the right or left common hepatic duct, the cystic duct, common bile duct, the ampulla of Vater, etc., right? And that can then go on to cause inflammation or infection of the gallbladder, of the liver, of the pancreas, and cause pancreatitis and so on and so forth. All right, so acute obstructive pathologies. And then finally, the E, the plus or minus E, is considering the possibility of an ectopic pregnancy in the patient populations where that may be a concern. All right, so again, just to review the major categories of acutely life-threatening differentials in the setting of an acute abdominal pain patient. V are your vascular differentials. I are your infections and inflammations. The P are perforations. The O are obstructions. And then E is considering the possibility of an ectopic pregnancy in the appropriate patient populations. All right, everyone, short and sweet, but hopefully you find this helpful in your clinical practice. All right, as always, take care and have a good time, and we'll see you in the next video.